jumping back into our next journal under our new name, Statistically Insignificant, which is pretty much like what our opinions are, but that's okay. You know, I really love that new name.
It's
But
good. You did a really good job. You're so much more creative than I am.
oh, every now and then I get lucky.
Start kitchen.
But
I'm
today we're going to be looking at randomized blinded control clinical trial to assess the effect of oral cannabidiol administration in addition to conventional anti-epileptic treatment on seizure frequency in dogs with intractable idiopathic epilepsy. And this was a paper that came out of Colorado State back in 2019 and was kind of one of the big first CBD papers that I know a lot of us as neurologists really were excited about because we had seen some of this preliminary data, especially when we were going through residency, and we're like, "Oh, okay, what's it going to be? What's it going to look like?" After we had seen like the Farm Bill and a whole bunch of other things kind of come out, and there was a lot of questions about that. So we will kind of dive into this paper. So, right off
Yeah.
the bat, what'd you think?
Um, I thought it was interesting. I mean, I don't think it was I think there were some subtleties in it, that I don't know that you would glean unless you, like, read the paper. Like, I mean, well, how many dogs was it? They started out with 22, but I think ultimately it ended up being just 17. Was it 17 dogs total or
Yeah.
16?
Well, 16 were used in the data set because there was one who I believe the owner admitted to actually starting CBD or
Oh, right, right,
alcohol,
right. Yeah,
and
yeah,
they
yeah,
rightfully went ahead and said, "Oop, we're not gonna use you in
yeah,
the statistical analysis."
yeah. Oh my gosh. Hitting intermission. Yeah, so there were 16 dogs,
Yeah.
right?
Yeah, the
Ultimately, whose data
altogether.
was, like, included, and for the most part, they were randomly assigned.
Yep.
So somebody used a random number generator. I think they even said that that person wasn't, like, associated with the study necessarily. Um, and roughly half of the dogs, is a pretty even split, got the CBD oil. And let's also clarify, this was not like something that you or I can go and purchase.
No, this was definitely not from, like, Joe's Smoke Shop or anything like that.
No,
Like a
we're not
99%
driving across the border to Oregon,
right.
to get this. Like, this isn't even like a commercially available product, I guess is what I want to say. And so I think that that is very, very important. And I think we can touch on maybe like FDA stuff as far as nutraceuticals and stuff like that in a minute. But half of the dogs got the CBD oil. And the contents of which were verified by via third party analyses.
Yep. I thought they did a
Um,
great job with that and kind of showing through that this really was true CBD oil, that
yes.
the THC was really minimal. Everything, all of those I think were less than 0.3%.
Yeah. Yeah.
So,
And then half of the dogs got a placebo.
yep.
So an oil, and I think they both were kind of, the goal is to flavor them similarly, so that dogs would, I guess, like consume them the same, and that also like the researchers and then the clients wouldn't be able to necessarily tell one way or the other, I guess. Chicken flavor. Um, and
Yeah, 'cause
so
they even used a product that was less than 0.3% THC on dry weight basis.
yeah, yeah, yeah.
That was
So
what
like
they used. Yep. It
when
just
you have to use that little THC on a dry weight basis because it concentrates, everything concentrates in
yeah.
these oils. And so then what? They all of these dogs were also already on some flavor of anti-epileptic drug.
Yep, and I think that is an important thing when you look at this pilot study. This was not
Yeah.
first exposures. This was not animals who just recently were diagnosed with idiopathic epilepsy. These are animals who maybe, and I think this is a great discussion point that they bring up. These are animals that already probably had some difficulty with seizure control and were refractory in
Yeah.
some regard. Um, and they did do a great job, I think, of going through and saying, hey, all of these animals had full tier two evidence. Now,
Oh, yeah, we should talk about how they were selected,
yeah,
right?
yeah, and so they had like over 200 some animals who were evaluated,
Mhm,
but then they only ended up with like they wanted to enroll 30 over 2 years, which was their goal.
mhm.
And then by the time that they ended with it, by the time that they said, okay, this many can come in, and then this many can get through, and then this many actually finished it out, they kind of ended up with the 16 that they did. Um, they were included in the study, and this was the one thing that I wasn't quite 100% sure on, that it kind of contradicted themselves. They said that dogs were included in the study if they met the tier 2 confidence of diagnosis for idiopathic epilepsy. So this would
Mhm.
have required CBC Chem to be normal, the neuro exam, the physical exam to be normal,
Age, like
appropriate age for idiopathic epilepsy, usually 6 months to 6 years, based on the International Veterinary Task Force Association. The one thing that was interesting, though, I don't know if these animals had come in with a bile acids prior, but I recall bile acids being on tier 2. Yet some of
they
these,
don't talk about the bile acids at all.
um, and
Yeah.
so and they mentioned that, like, hey, one of the things we wish we would do in the future is assess the bile acids for
Mhm.
some of these animals that started showing some changes to their liver.
Yeah.
Um, and again, they didn't really dive deep into, like, okay, did they get the bile acids prior or not? So that was the only thing with the tier 2 confidence that I was like, wait, I thought bile acids was technically a part of tier 2. Um,
Yeah.
but I guess I have seen some places where it depends on how you interpret that phrasing, right?
Yeah.
At least here at our institution, if we want full tier 2, we do consider the bile acids to be a part of that. So
So when does MRI, just for people who aren't, like, familiar, when does
tier 2, yep.
yeah,
MRI, yep, sorry, my
okay.
bad. But MRI, CSF, both are tier 2.
Yeah,
Because
so, like,
tier 3s are
it's a
EEG.
thorough
It's a pretty good workup. Yeah.
yeah, and so, like and I was gonna say, like, I know that these dogs I was an intern when they were collecting
Mhm.
data, but, like, just a rotating intern, and so, um, they did their best to rule out basically, like,
Mhm.
structural causes of seizures and then, refractory epilepsy as well.
Yep.
Or not refractory, I'm sorry, reactive. Yeah.
Active, yep, and a lot of these infectious disease etiologies were cleared, and then they even had, said these dogs have to have good standards of control in terms of their serum levels, phenobarbital, bromide. Like, they didn't want anyone who was kind of just down here pitter pattering in the,
Yeah.
on low ranges. So I really did. I think they did a really good job for a pilot study going through and doing that. I think the downside was they had all of these other drugs, right? So
Mhm.
there was no true protocol, which if they tried to do that, they'd still be recruiting to this day. If they tried to
Well,
have
and
every
even if
dog on
you
the same
tried to do
protocol.
that, I think you would get into IACUC issues maybe?
Yeah, I
Do you
mean,
think?
you either would have to wait until dogs naturally came on just phenobarbital,
Yeah.
just, eh, because yeah, if you start
Well,
then
and you
saying,
couldn't, like,
"Oh,
withhold any of those
yeah,
drugs.
you
You
can't
can't
withhold."
withhold any of those standard of care drugs,
Yeah.
right?
Oh, yeah, yeah. No, that would be totally out. Because those are considered the standard of care. So yeah, and again, to otherwise get the groups and just wait for them naturally to get that many per group
Yeah.
or be within the same range. Again, I all that to say, I think they worked well within the confines of the reality of veterinary medicine, uh,
Yeah, I think so too.
and for that, I do give them props. And so as they were going through, um, kind of did all of that workup, and then and they mentioned this as a limitation. They relied on the owners to say, "Hey, when are their seizures? What are the frequencies?" Those kind of things.
Right.
You
And,
know,
like, are we missing seizures that they're having when they're asleep? I don't know. Most of my clients seem to notice when they're asleep. They won't
I
tell
would
me,
agree.
they're like,
Yeah,
"That's
and I
when
think
they
we
all
all,
happen."
yeah, and sure, yeah. Are you missing one? Maybe potentially,
Yeah.
but I think if we say for these owners and their frequency, they probably know their dog pretty well. And it is a limitation we all have to acknowledge. But I would agree with you, right? It's most of our owners are really good, but
Yeah.
things happen, but they also know the clues and things like that for when they're not home or things like that.
Yeah.
The other thing I thought, how'd you think they did coming up with their dose that they started with?
Well, I mean, and I think they get into this a little bit in their discussion and then also in the other paper we're going to talk about. I mean, I don't know how you could have done it any differently because there's no
Yeah.
reported dose out there that exists that has ever been even assessed in dogs. So this was very much so they were extrapolating from the human data that's out there and basically like looking at the low ends and they're like, okay, well, we'll start here more or less, right?
And yeah, and I thought it was a great approach to coming up
Mhm.
with that first dose. And I think they hit the nail on the head with this one. Down the road, they're like, okay, we know that some of these human studies were a little bit higher in the mg per kg, but we know that we have a lot of differences between dogs and humans.
Yeah.
And I really think they took a really responsible approach to saying, okay, let's do the math. Let's kind of based on what knowledge we do have, extrapolate from there. We're going to start at 2.5. And through this study, they found we probably do need to go higher.
Yeah.
And I think that was a good thing. But all that to say, I think they, in terms of thinking through this process, who we're going to include, what they have to meet, and how are we going to dose this, and how are we going to validate the control of the product we're giving. I really, it's clear that there was a lot of really good thought that
Yeah.
into this.
Yeah, I agree. So the dose, speaking of the dose, it was, you said it was 2.5,
It was. Yep, it was
2.5 mg
2.5.
per kilo twice a
Yep,
day.
yep, for 12 weeks, twice a day.
Okay.
Comes out to about 1.1 mg per pound.
Yeah. And so we already talked about how, it's a there was a placebo, so that's always really nice. This is a blinded study, which is also very good. It's just kind of increasing your confidence, right, in the data that you're being given. And then also, um, they acknowledged the dose, and then they were monitoring seizure control, and then they were also monitoring some other things. So, in addition to monitoring, it was monthly, it was every month, right? They were
Yes.
measuring serum levels of, um, CBD basically.
Yep, and then CBC, chemistry, and then depending on what they were on, pheno or bromide.
Yeah, and, like, some of these dogs are also on zonisamide, but it's just, like, they weren't measuring those levels. I don't routinely do them. I know you guys run them at Auburn. I don't.
But I would say that we're biased towards it
Yeah,
because we have individuals researching it and trying to better understand that therapeutic range. So,
yeah, yeah,
um,
so they didn't do that here. I think that's probably okay because there's no standard that says you need to be monitoring zonisamide levels anyways.
I would agree. I would agree.
And
Uh,
so
the other
the
big thing that they were monitoring was that CBART, which is
Oh,
a
right, right.
based survey.
Mhm,
Um, and I think that's a really good because we talk about CBD and what is it going to do with fear and anxiety and some of these other utilizations
mhm.
of it. And so even though it was like not their intended focus area, I'm really glad that they did that.
Yeah, it was kinda cool. It was like a little
Yeah. So
extra stuff
I
they got.
I enjoyed that because some people be like, well, does it help with anxiety? Does it not? And the anxiety is the one that really comes to my mind,
Yeah,
as being it. And they really showed that it didn't change behavior or aggression or fear or anxiety either
which
way.
I think is, like, really helpful
Yeah.
because I have people that, like, ask well, I they ask me about using it all the time for everything.
Yeah.
And so it's just kinda nice because I think I asked one time on, like, Instagram, I was like, "What do you all use this for?" And, like, the vast majority of people, my friends, actually said they would, like, recommend it for, like, anxiety. And, so anyway,
Yeah. I'd have to deep dive into the literature
I
on that.
digress.
But yeah. And you wonder, like, well, when we get to the other paper, like, they kind of still repeated it and still didn't find anything crazy. But you do wonder with
Mhm.
higher doses, what's that play there for it?
Yeah. And
Um,
then they went on to say, so whenever you're doing these studies and you're saying, is this medication helping or not? It's not just simply looking at did the dogs that actually got the drug or got the treatment or whatever, did they respond? Did they have a decrease in this case, seizures? But
Mhm.
they had to actually, you have to like define what is going to be a responder. Like, what are you going to say is a responder? Because there's so much individual variation in seizures from dog to dog that you really have to be very careful, I think, because otherwise you cast too wide of a net and you're including animals that are maybe, yes, have a decreased seizure frequency, but maybe was their epilepsy just going to do that anyways, right? And
Yeah.
so they said if the dog is going to respond, they need to have had a decrease in seizure frequency, so the number of episodes by 50% or greater, right?
Yep.
Um, and so let's see here. Basically, so then we're in the results, right?
Correct. Yeah. And I think that was pretty much how they set it up. Again, overall, I was pretty happy with the setup. This particular team, when we're critically evaluating this, this is a team who knows CBD. They're known for doing the research for it in epilepsy. So it's certainly a group of individuals that I trust and also have the capability to do it a lot easier than some of us, depending on states that we are in, especially back in 2019. So
Truth. Truth. Oh, I did think it was interesting that like a ton of the dogs were neutered male dogs. Like
yes.
the vast majority of their dog, I mean, in the groups, it was like an even split. Like, but the majority of the dogs that were included were castrated males, and I feel like
Yeah.
that was true for the next study too, as well.
And in the next study, they specifically mentioned none were intact female.
Hmm.
They did not specifically mention that, and I wasn't sure whether that was an enrollment criterion or not. But I can imagine that saying, well, the intact females and the potential hormone, we're gonna step
Oh,
away.
for like the estrogen, like making them, yeah.
So they didn't explicitly say it, and I picked up more of that vibe in the other article,
Mhm.
but at least here, yeah, I thought that there was definitely some higher neutered males. Um, Interestingly enough, I was surprised that and I think they made a very good distinction in the title that this was for refractory epilepsy.
Mhm.
And so knowing that they took a cohort of animals who are already having trouble responding,
Mhm.
I was okay with them bringing in the Australian shepherds and these other known to be refractory
Yeah,
animals.
the naughty ones.
Yeah,
Yeah.
but you have to ask. I wish they would have broken down, were those breeds in which of the responders, what were those breeds?
Yeah.
Because it would be nice to know. And they probably were like, you know what, we don't have enough data here to say this
Yeah, I don't think there were enough
one
dogs,
way or
I
the
don't
other.
think.
Yeah.
Yeah.
And but again, I think that's one limitation of this study to begin with, right? Is just the number of dogs. But
Yeah.
I think for a pilot study, very good. You know,
Yeah.
I think we all would have been happy with, for a first time out the door pilot study. I think they hit the numbers
They
that
did a great job.
yeah. And
Um,
so, but yeah, I just would have been interesting to see, of the
yeah,
ones who did or didn't respond, and that's, I think, for the one thing that I really want people to take away when we look at this is that these are animals who already had some refractory to therapy.
yeah, and if you're not familiar with the term refractory, correct me if I'm wrong because you're the seizure guy. I hate seizures. And I realize that's like saying cardiologists hate heart murmurs, but I swear I don't hate them. If you're refractory, that means that you are on, what is it, 2 or more drugs?
Yep.
Like conventional, like good, like top tier drugs, not like gabapentin. And you are at appropriate doses and you have appropriate serum concentrations if it's a drug that you're doing serum concentrations on, right? Like we're not doing that in Keppra either. I see some people do it. And I just feel like it's such a waste of money.
Yeah,
Uh,
it's again, in a research setting where we have grants that are paying for it, I'm all for it. If I'm
yeah,
asking clients to pay, I don't know that I have enough information.
I wouldn't know what to do with it. I wouldn't know what to do with it. Anyway, so all that to say, you're on a good drug, you're at appropriate doses, you have good serum levels, and you still have crap seizure control. That's what it means, right? If you're refractory.
Yep.
Do you have anything else to add?
No, I think that was great,
Okay.
and so I think that to apply this to just a blanket statement for all seizures would be inappropriate.
Yes, yes, 100%.
So I think that's the biggest thing. And knowing that they're doing this research
Probably in the
in the
toughest cohort of
toughest animals.
dogs.
Yeah.
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 So the results, when you just look at the dogs that were responders, it was, remember, responders was decrease in seizure frequency by 50%
Right.
or more.
Yep.
You really only had 2 dogs, right? 2
Yep.
out of what was it? 8? 8 or 9 in that group?
I want to make sure I say the right number.
9.
Yep. Nine from
Mm,
the CBD and 7 in placebo.
yeah,
Only
so
2.
not a lot.
Nope. And again, I
However
think yeah.
however, when they looked at overall, still the decrease in frequency, there was actually statistically significant decrease, right, between the 2 groups. So, I thought that was interesting, and I guess I didn't really know what to do with that information a ton, um, but it was still interesting.
It was, and I think the flip side of what they did not find though was the total number of responders between the control group and the CBD group
Yeah,
was not different.
it
And
wasn't different, yeah.
I think that is suggestive, right? That in my mind, what I'm hearing this paper say is that okay, some dogs might respond. And when they do, if they're going to, it probably is going to be statistically significant.
Mhm. Yeah,
But that we should not assume that it's going to work for every dog. And I think this mirrors how they viewed in the human world. We
yeah.
know that there are specific types of epilepsy in the human world that are responsive to this. And we know that there are certain types that are responsive to certain medications. And we have so many different, genetic variants and things like that, that by golly, we know we don't understand in vet med.
No, like, none. I tell people all the time, they're like, "Oh, so there's genetic tests for it?" And I said, "'Cause I'm calling it genetic epilepsy." What? Not what I mean. I wish.
Yeah. No, well, whole genome sequencing, a little expensive still for just, dogs and cats on the random, but we'll get
Yeah.
there. But yeah, so I think again for dogs that it is, and that kind of fits to how I have practiced. And being in the deep south, I have pretty strict limitations on how I can use this, and it's
I'm
very
in
much
Idaho. It's the south of the West.
yeah, fair. It's very much a owner beware.
Yeah.
And if you're going to use it, get it from a very reputable location and source,
Yeah.
not Joe's Smoke Shop. Um, and if you're going to
We
use,
don't actually know if there's a Joe Smoke Shop.
oh yeah, don't yeah. If Joe is out there and
We're
gets,
sorry, Joe. We're not coming at you or your business. Ryan's
no,
just
no, just
we don't know. We
you
don't
just
know.
gotta
I don't
trust it.
know Joe's Smoke Shop.
Yeah, because that was one of the first papers that came out when CBD oils and things like that were coming up. Was that there was a paper that came out and said, "Hey, the products are all over the place. They don't match the label. The
Yeah.
the testing is not being done, and so you have to get it from a reputable source because you
And
don't
then
want
but
that
then
high
it's like, what is
contamination."
reputable? Like, I
Yeah,
think
well,
you
it's
could go
fair.
down a rabbit hole that's like,
Oh,
what's
you could.
reputable? How do you know? Like, one thing that I tell clients all the time, and we'll get into a little bit more of the data, but like, since we're already on this topic, these plants are crazy. These hemp plants are, I think they call them soil remediators,
Mm,
right? I don't know if you know this. I looked into this because I was like, is this just nonsense? When you have something that's a soil remediator or like I guess a soil extractor, so they're really good at like pulling nutrients out of the soil, but they're also good at pulling like naughty things out of the soil, like heavy metals and stuff.
mm,
You know they planted these around Chernobyl.
I
Did
did
you
not
know
know that.
this?
No.
Dude, yes. To like clean the
Cleanse them,
soil, decontaminate it. So like all of that stuff gets ultra concentrated in oils. And so that's why I tell people, I'm like, I don't even know how these people are growing it. Are they measuring like lead levels and like arsenic levels in their
fair.
in their soil. I don't know. So to me, it's like it's one of those things where I think we have such a bad habit of like saying, "Oh, I can't tell you if it's gonna help, but it probably won't hurt." But I get a little nervous sometimes with some of these things where like,
We can't say that.
but what if it could hurt?
No, I think that that's actually a very fair component and something that we don't think about is where is the source? What is the level of safety evaluation?
Yeah.
Because there's
'Cause
certainly
there's nobody what
regu-
clients don't understand and what I need the general public to understand is like nobody is looking at the safety of these nutraceuticals the way they are prescription medications.
right.
It's not, it doesn't, and not even the safety, but like making them provide data that says like, I say that this is like X amount percentage is in here of whatever. Like they don't,
Mhm.
you're like relying on good faith and actually good third party analyses. And even the third party analyses can be so variable depending on who's doing it.
Yep, and the methodology that they're using and
Yeah.
all that. And so, no, it is something. And I know there have been people. There was a clinical pharmacologist who was out there who was saying, "Hey, if you can't get a certificate for the batch
Yeah.
that you're using, you should be very cautious about it." And I think that's very fair. And we have to hold these companies to a high degree. And there's been definitely some companies that come out and they're saying, "Oh, we do this and this, right?" And so everyone kind of jumped on that bandwagon 2021, 22. We saw a big
Yeah.
burst of groups
Mhm.
onto the scene of these products. Um, but again, I think at the end of the day, it is, and there is one FDA approved version, Epilex. Um, and we saw that be pretty cost prohibitory for a long time. One of
Mhm.
my colleagues here says he just did a cost analysis and thinks the pricing might be more obtainable now for vet med. I haven't seen his publication come out yet, but certainly we see that all the time, right? With these new prescriptions and things come out that they start out really expensive and then eventually they become
It's like
affordable.
pregabalin. We couldn't use
Pregabalin,
pregabalin.
Lyrica,
Like at
yep,
the beginning of my residency, we couldn't touch it.
couldn't touch it, couldn't
But
touch it.
now I'm like,
Yep. And so he thinks that it's just kind of balanced to where we think we can, but that's kind of outside the scope of today. But let's talk about what people often think. What are the side effects? What could go wrong?
yeah.
And this study was not without side effects.
Mm-mm.
Matter of fact, 3 dogs were removed,
Mhm.
from the CBD group. One who continued to have pretty bad seizures and was actually in status, and so that one was euthanized.
Yeah.
And then 2 that had ataxia.
Yeah.
One, also had cluster seizures and ataxia, and ended up being euthanized, but the third one was taken off of their CBD oil and improved.
Yeah. Yep.
And so we definitely have dogs that are going to have a physical response to some of these medications, being ataxia or loss of coordination, loss of balance
Yeah.
there. And then ALP, the liver enzyme.
Yeah. Yeah. ALP just shot right on up in those dogs.
It, this
And
is
that
not
really
the first study to show that.
no, and they showed it again with their the other one we'll talk about. So ALP increase. They specifically talked about how they did not test bile acids in these dogs to see if
Yep.
it was a functional thing. I think they speculate that it probably has to do with the SIP, right?
Yep. Yep. This.
The cytochrome P, right?
Mhm. Yep.
Um, isoenzymes, just because that is so in humans, phytocannabinoids are extensively metabolized by hepatic SIP enzymes, and CBD is a potent inhibitor of SIP enzymes. So,
Yep.
yeah, so that's probably why they did not document any, I think, ALT elevation in this study. Um, so yeah, I don't know. I mean, I think ultimately, let me see here. They didn't report in this study um any like somnolence, so that excessive sleepiness, decreased appetite. or
No
diarrhea.
vomited in this study.
Yeah, they didn't see that in this. So I think it was a good pilot study. They
Yep.
did have some responders. It wasn't a ton
Mm-mm.
by any means.
Nope.
Um,
And to me, it definitely matches what I've seen in practice. Like, there's these handful of dogs that the owners opt to put them on, and then they swear by all that it was the drug that made the difference. And I think this study supports that some dogs, some individuals may have response.
I had a case during residency. She somehow was mine. I feel like I inherited her from an outgoing third year maybe. She was terrible. She was terrible. She like was hospitalized every 3 weeks for clusters. Hospitalized. We put a port in her.
Yes, this one.
Do you remember?
I remember her. Yep.
Um, I said basically was like she was on everything. She was on everything. It's to the point where I was de-escalating stuff because I was like, none
It's
of
not.
this is kind of helping. She went on CBD. Remember that one that's called Chroniquin, which is a hilarious name. Um, she literally went 6 months.
Yeah.
And then
It's
you sit there and I'm like, that's one dog. And I'm literally like thinking about things that I'm directly telling the listeners, like, don't do that. That's not, that's correlation. That's not cause and effect. But it does kind of make you go, well, damn.
that's like the Chiari dog that Dr. Cridge and I put on Cermania.
Oh my God. Okay. But I had the same thing happen.
Yeah,
We can't talk
that's
about
a whole nother. Yeah, that's a whole
we
nother
can't
can of
talk
worms.
about
Uh,
substance P right now. I only have so many functioning cells right now for this. So anyway, that was that study.
yep. And
And
again, I think it was a great pilot study. I think it showed maybe, right? I think is the takeaway is that maybe for individual dogs, but that compared to maybe other traditional pathways, it maybe isn't better.
yeah,
And that there might be some liver side effects, some general side effects like ataxia and loss of coordination that come with it. And it's known to affect liver metabolism. And so I think the
yeah,
other big question is how does it play with our other medications?
yeah. And they did at least say like, hey, it didn't significantly change, the levels of bromide or pheno specifically
Correct.
in the dogs, which was nice to see.
Us.
So well, good.
Yeah. Yeah. No. So I thought this was a great first paper, especially when CBD was really coming onto the market and we had a lot of changes with it. And so at least for me, it said, hey, you know what? It kind of supports this buyer beware. It may work, but here are the potential risks that
Yeah.
you have to be aware of, both in product and in response in the body, which I think are
Well, you
both.
gotta look it up. You gotta look up
I'm gonna have to
the
check this out.
Chernobyl thing. Like
This is excellent.
it's wild. Um,
And so this second group said, hey, watch us do it again.
yeah, I know. It's most of the
Most of the same group.
same
Yeah.
homies on it. Bartner, McGrath. Um,
And I think the other great thing, and this next bit we're going to be looking at the efficacy and safety of cannabidiol as an adjunct treatment for drug-resistant idiopathic epilepsy, again, drug-resistant, and 51 dogs, a double-blinded crossover study, and
many more dogs.
many more dogs. And what I loved when I was rereading this paper was that you could tell that they took this pilot study
Mhm.
and they said, okay, here's a hole, here's a hole, here's a hole.
Yeah,
And they plugged them up when they went to this next higher level, more in-depth study.
yeah,
And it was a great way that I think for someone who's maybe interested in science and approaching and how to ask a question, how do I do this financially and prove that at least there's something here and then take it and get good grant funding? I think this group has shown a really good way to go do it and then grow your research through it.
yeah,
So I,
for
I,
sure.
I really enjoyed seeing that as I reread these was like, oh yes, you were there, and that was your
Mhm.
issue on the last one. So
Uh-huh.
I really like that.
Yeah.
So
A
thoughts
lot
on this
more
paper?
dogs. Well, a lot more dogs.
Yep.
Just so we all know now, we're getting into like a more elevated study design. We have a double blinded. So double blinded means the owner doesn't know what the well, if this is human medicine, the patient doesn't know what they're getting, right? In this case, it's the owner doesn't know, but then also the investigator doesn't know what you are being given, right? So that's what double blinded means. And then crossover. This is like ultra great in my opinion. So when you cross over, it means you start off with two groups. Um, One group is getting the placebo, one group is getting the treatment that's being investigated. Then there's a washout period where you don't get anything for a period of time. And then you actually swap them over. Um, so both groups are exposed, admittedly at different time points, but they are exposed to both therapies, well, the therapy and the placebo, right? Which is pretty
Yeah,
cool.
it is. It is. And
It takes a lot
so
of time to do these
there's a
studies for
lot of
a
time, a
reason.
lot of work, a lot of effort.
Yeah.
But again, I really think one of the best things about this group is they're taking this big question that we have: how does CBD affect dogs with resistant epilepsy?
Mhm.
And they're taking the time to do the research right, not just throw it out there and say, "Wow, it clearly has been." You know what I mean? These
Yeah.
are really good studies and really foundational. And so, you got to give props to that group for thinking through this, going about it the right way. I think the big thing to talk about this study, and just so no one thinks that, oh, why'd they do that? That's not justifiable. So, interestingly, 2.5 mg per kg was the dose that they started with in the last paper. And they
Uh-huh.
said, "Ooh, we got to go up." And then they started at 5 mg per kg,
Literature, they go up to 10, right?
9.
9, okay.
Yep. Per day, mg per kg per day. So that's the other big dose, is that this is 5 mgs per kg per day.
Mhm.
They went to 12 dogs, and then they said, "Hey, we're going to need to go to 9 mgs per kg because we aren't seeing any response."
Yeah,
And they justified this through some of the papers that they've seen in human medicine and some other applications of, "Hey, here's why we think that these doses need to be higher." And that's when they went, and that's how we got the 9 mg per kg per day for
yeah.
the second 39 dogs.
Mhm. And so, overall, I feel like a lot of it was very similar still as far as the things that they were monitoring, where they sourced the CBD from, correct? None
Yep.
of that changed. They did I think
Still
to increase their inclusion criteria, what they did was they were like, "Okay, if you can't get here for routine blood draws, you at least need to be able to work with your family vet to still send them into our lab." I feel like that's how they got around that. Maybe they got more dogs involved in that way.
Yeah, and the only little tiny, like, error I found was one place they said 12 dogs got the 5 mgs per kg, and then another they said 13.
Mm,
So I wasn't quite sure, but
I didn't even catch that.
one was in the abstract and one was in the methods. I just think.
Gotcha.
Um, but that being said, so 9 mgs per kg, which came out to the 4.5 mgs per kg Q 12 hours.
Yeah,
Was for it. And you know what I bet? I bet that those numbers that they use in the abstract were after they were the final dogs used in the final analysis.
probably.
But that's what that was. So I doubt it was probably not an error. That was probably a misspoke on my part. It was probably those dogs that were removed from the study for various reasons.
Yeah. And the dogs received the treatment still. The treatments were given for 12 weeks total, but there was a 4-week washout period for each.
It was interesting. So in their enrollment, they screened 502 dogs, ended up allowing 61 to come in, and then ended up with 51 by the time that they ended all of
Yeah.
the studies. Interestingly enough, I was surprised by some of the ones that they did allow in. Like, they had an acute kidney failure, an intestinal um the intestinal
Perk?
perforation.
It was like perk, yeah.
Um, I couldn't quite tell if that was before or after or concurrent. They also had
I
ones
don't
like with hyperadrenocorticism, which I was shocked, hypothyroidism. Those are two I probably wouldn't have let in, but hey, again, if we're going with resistant, I suppose, but just seems like those would have been dogs that have.
well, and then so the reason Ryan is, like, saying that is because these are things that we know can, like, at least, for hypothyroidism, right? It can potentially worsen seizures.
Yes.
And then I guess with honestly hyperadrenocorticism, you could make an argument that it could cause seizures.
It's a tougher argument, I think, but I
Yeah,
mean, there is a neural form, and so
yeah.
not necessarily be seizures, but
There was a dog that also had cerebral microbleeds.
I
Do
saw
you
that,
get that
and
too?
I was interested. I'm intrigued by their statement that the microbleeding was not considered to be the source of seizures for this patient.
Well, and that's probably so there was that paper that came out. Do you remember when it was like looking at all these like putative cerebral microbleeds that they were finding? We were finding and actually like dogs that we were imaging, be old dogs because of vestibular dysfunction. And then they were just like, why's everybody got Swiss cheese brain?
I
Um,
kind of wondered if that statement came because of that paper. They were like, well, so
maybe they were like, nobody else thinks it's a big deal, so we're just going to include them. I mean, it would be one thing if they let in like a dog with a massive intraaxial hematoma, and I would have been like,
they would be like, come on now.
"Whoa, bro!"
Yeah, but
But
yeah, I wish they kind of would have sourced that paper actually, because that was
yeah,
what I thought of. I was like, well, I get why would someone would think, but I also there's some justification for meh ignoring it.
I know. I mean, I kind of go meh when I see them.
Saying, it's one that's like, well, I better go look and see, see what I can find, right? But
Like, I gotta make sure there's not a reason for them, but like, I'm probably not gonna find a reason for them. Um, Putative cerebral microbleeds for anybody listening to us ramble. It's just like basically these teeny, like they're small, they're not large bleeds. And honestly, a lot of the times we think they're going like clinically silent, like we're not noticing when they're happening. And we'll just find them as just tiny little dit dots throughout the cerebral hemispheres. Anyway, we see them very commonly in old. I shouldn't say commonly, not infrequently, maybe is a better way to say it in older dogs.
yep,
So anyway, um, they did let in some interesting ones, but
yep.
maybe at least for some of them we can kind of give justification for it, I suppose.
Yeah. No, again, I think, if they wanted to take it maybe to that like really high tier, but again, we see all these cases come in, how do you find these dogs that have nothing else wrong with them sometimes? Or
Yeah.
are you ever going to get your numbers if you don't? And, you're finding this balance of certain grant cycles have to be completed in certain time
Mhm.
frames. And so,
Yeah.
you find the balance of like there's perfection and then there's reality.
Yeah. Yeah.
That all said, they've been very upfront about who was included, why they were included, and the justifications for that. And I think,
Yeah. And like
I
some of the CSFs were weird on the dogs, but they repeated a lot of them and they were actually fine. It's probably just from blood contamination.
no, I thought they set all of that up, and again, really just leveraged on what they had seen previously.
Yeah.
And so, looking at some of their results as we kind of dive into that, I think a couple takeaways when we look at this and compare it to the previous study of the big banner takeaway, kind of the same finding, almost the exact same finding of
Yeah.
some
But in a
dogs
weird way. But in
in a
a
weird
weird way.
way, that some dogs responded, and when they did, it's probably statistically significant. Also, that in comparison to the control group, the number of responders still was not different.
I know. I know.
So, and yeah, some of the way that they presented it was a little different compared to the previous study.
Yeah, so they talk about this took me a second. I had to read this a little bit because I was like, wait, am I missing something? I don't like stats, but I was sitting here staring at the diagrams and I was like, okay, I think I get it. So basically, if you read the results, actually all of the dogs still had like increasing seizure activity. They still did. They were overall the number of seizures still increased even in the dogs that got CBD, but it increased less. It increased less, and like significantly so. Um, so maybe that was it's a weird way to be like, yes, it helps, I think.
It is. It helps. They all got worse, but they all help. It helped them get worse less. And
Yeah.
but at the same time, I think you have to compare that to the control group that did the exact same thing.
Yeah. They still did it, just to a less magnitude
Yeah,
or to a worse magnitude. Sorry.
worse magnitude. Yeah,
Ah,
yeah.
I'm confusing even myself.
It's okay. Yeah,
Something that I think confused me a little bit. I was sitting there and I was like, wait, I don't understand. They're saying that the seizures increased, but then the seizure days decreased. Did you catch that?
I did. They really on this one. They really focused on the seizure days.
Yeah, and so the seizure days decreased, but then you're looking at that and then you're like, okay, but you're still saying the number of seizures ultimately increased, right? I guess they actually commented, I think it was this paper, about how most of them were clustering.
Yeah, they did talk about
So,
that a little bit in this one.
so if you're going to cluster, you're having two or more seizures in a 24-hour period, right? And so, like, that's why you can still have more seizures. It's essentially what I would look at that as, and I don't know if I'm interpreting this correctly. Like, the dog's clusters still got worse. Like, they had more seizures per cluster, maybe, right?
Yeah, it was a little bit. It's just a different way of how they phrased it in terms of all of it. And and the one thing that they really did look at was even though the responders were not different, right? That total days of seizures was what came down. It was like a 24.1 decrease in seizures and then the 5.8 in the placebo group.
Yeah.
And they did address it. I was trying to find the part here where they talked about
Like
that's
the discrepancy between those two.
yeah. So, and the increase could be a consequence of some of them having large numbers of clusters, and so that
Yeah.
was the thing. Was like, hey, the clusters themselves could have been, but then like the seizure per day, like if you just say yes, no, kind of turned it into a binomial, that got better, but maybe that the total number got worse because the clusters progressed.
That's how I took that away. I was like, that's the only way that I can make this make.
This worked. I think that's why they chose to present it in that way because
Yeah.
that's where you saw the improvement was number of seizures, and or sorry, seizures per day type approach. Um, and I phrased that wrong, not seizures per day, but seizure
Uh-huh.
days.
Yeah.
To
Yeah.
make sure I'm using the same terminology, which all things considered says that yes, even though when they have a seizure, because this population is just non-responsive, they're more prone to clusters. I did appreciate them sticking and allowing the cluster protocols to still be in place. Uh,
Yeah.
but they said, okay, the total number of times that happened was better. And so
Yeah.
again, I think it's how you're looking at it in terms of
Yeah.
what kind of data do we want and what do we care about the most.
Yeah.
And again, I don't know that I would select CBD as the end all be all for dogs maybe who are more prone to clusters, especially not as a cluster protocol solely, right? I think this is more of a management, a maintenance type pharmaceutical
Yeah.
approach, far beyond what we would want with cluster seizures. Now, not saying there's not a role for it. We certainly have not looked at that. But I think this study is like, it makes me wonder, like, oh, is that not a good use, right? Is this something that has to kind of be up there? But it has that really short lifespan, within the blood. And that's another thing is, and I was surprised that they didn't talk about it too much. Is twice a day enough? You know?
Yeah. And then also, they commented about how things weren't really So yes, good point. Is twice a day administration enough? Because like it's like when you look at the Keppra, some of those dogs are like chewing through their Keppra,
Yeah,
even the extended release to the point where you're like, do you need an extended release every 8 hours? I mean, I have to do that sometimes. So like, yeah, is that enough? But then also, they did not standardize serum draws. As far as like timing of when the sample was collected in conjunction with administration of the CBD. So when they were tracking kind of serum concentrations of CBD, they even admitted they were like, hey, like we maybe in the future need to be standardizing this a little bit more. Um,
they did. I
yeah.
was I was I think they did a good job of kind of going down that pathway of how does this affect our other seizure meds.
Mhm.
Kind of, we didn't see too much. I don't know how many zonisamide dogs that they had, but they talked about how, in theory, that would probably be the one because of some of the overlapping of metabolism that would be affected. But interestingly, it was an 11% increase in phenobarbital concentrations during the
Yeah.
CBD phase that was compared, um, which
But
was
yeah,
interesting,
but what is it like? I don't know. Was that from the CBD or was it from the Zoni?
right?
Right? 'Cause that paper
Was it
just
would
came
have
out
just
about,
happened? Yeah,
zonisamide maybe potentially increasing serum pheno levels. So, um, I don't know about that, but yeah, so the phenobarbital levels, they did increase. Didn't they say it wasn't statistically significant though?
it was no significant effect of CBD on phenobarbital, so it was more of one of these observations type
Gotcha.
thing. Again, I think we would need a lot more
Yeah.
to get information from that. Um,
And then something they noticed the similar effect on ALP was also noticed, like from the previous study, the one we first talked about. In this study, they said, "Hey, yes, ALP like increased a lot."
yeah.
Uh,
So all things considered,
but then also, didn't ALT increase a little bit in these dogs too?
it did. So ALP and ALT increased in both of these dogs.
Yeah,
Sorry, there was two dogs actually that had additional um bile acids performed
yeah.
that actually had bile acid elevations as well.
Mhm, mhm.
And so it was those dogs who had bile acid elevations and ALP, AST, and it looked like the ones that had the AST were the ones that had the bile acid elevations. No, it was ALT. I apologize for missing.
ALP, yeah.
Um, had the dog over here going crazy in the corner. Um, so two dogs that had increases in ALT activity
Mhm.
also had the increased bile acids.
Yeah,
And so I think the big takeaway is one, does it dramatically affect at these doses for the other seizure medications? Clearly, it might be messing with pharmacokinetics a little bit. We probably need to look into it, but clearly it's not like a slap you in the face. Oh my God.
this happened in all these dogs, blah, 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 and the magnitude was outrageous, and
Which makes me feel a bit better using it with some of these medications.
uh,
Clearly, we need to continue with surveillance and being aware of
yeah,
things. In that we had dogs that had ALT and ALP elevations, and so it's almost like we have to treat it like phenobarbital in that
but
when you start getting those ALTs and they start becoming like we probably have to look and consider this is not a great medication for a dog with liver limitations.
yeah, yeah. And then they at this higher dose, they noticed some side effects,
They did. They
some
did.
other side effects. So not just like clinical pathologic changes, but man, fair number of these dogs had a decreased appetite.
Yep. And
Um,
the vomiting and appetite changes and
Huge.
liver changes, those have been seen in other patients as well.
Yeah. And look, a lot of them also had anxiety.
Yes.
Like their anxiety worsened.
Yep. But it wasn't, it was interestingly not as bad for like the CBARC scores weren't different,
Yeah.
but these ones were. And so it was interesting also to me the number of dogs in the placebo groups
Mhm.
that had these. And so you have to wonder how much the vehicle's playing a role.
Yeah. Yeah.
And that upset the tummy a little bit. I cannot explain how it would change the anxiety.
No, but still, like, I mean, honestly, like 6 dogs in the placebo group versus 9 with anxiety, I don't think that's a huge
No,
like, maybe they're
no,
all just getting weird on their seizure drugs.
yeah. And so if we're looking at it, the decreased appetite and the vomiting were the
That's
two
the worst.
were the worst. Now, they did not in this table include the liver enzyme elevations.
No. Mm-mm.
Um, but and again, the vomiting is what we had seen in like one of the very first CBD papers that came out in dogs. It was vomiting and liver enzyme elevations. And so this is kind of mirroring some of that historical knowledge that I've always told clients, hey, look, it's doing something with the liver. It may cause GI upset. These
Yeah.
are not things that should be surprising.
Yeah.
And I think these are all things that we deal with other anti-seizure medications as well.
Yes.
And so it's not necessarily a, oh my gosh, but if you're thinking that this is it's this purely natural substance and that means it's safer and it's better, well, I'm going to remind people that acetaminophen, Tylenol, is also very naturalistic,
Yeah.
and that it also causes liver enzyme elevations and has its own.
Uh,
I can't take acetaminophen without becoming nauseous, and so all that to say, we have to use it with caution. It's not just a supplement we should be throwing out there. And I think for me, if I have owners who are like, okay, well, I'm going to do this, and you're like, okay, well, because of where I am and where I practice, can't help you.
I mean, legally too, we like I can't say anything.
Can't like, yeah, can't recommend it, can't do it. But I was like, if you're going to be using it, you're coming in, you're telling me you're going to use it. Please watch out for these.
Yeah.
You
Yeah,
know,
for sure.
your dog,
For
your
sure.
property. At the end of the day, and here's what we know about it. But I can't prescribe it. I'm not going to provide a dose. Those kind of things based on where I'm at. Now, there's certain states that I consult with that we have a little bit more leeway, and I let those veterinarians kind of know, hey, your state, depending on your laws and regulations, it's up to how you want to do this. But here's the safety. And again, I think the takeaways for me on these two studies were that it is not. It's to me, it wasn't all that surprising of a study.
Mhm.
It mirrors the fact that we knew at the very beginning, CBD is not a miracle cure.
No, it's not gonna replace it absolutely is not gonna replace our standard tried and true phenobarbital, potassium bromide, um, and it shouldn't be, I don't know, marketed that way. That's a whole nother
No,
thing.
yeah, it definitely should not be marketed as this safer alternative, this more
Mm-mm.
effective alternative. That is
Yeah.
definitely not what it is. But in certain dogs, likely with certain types of epilepsy that we just as veterinary medicine as a whole have not been able to identify, it probably could be theoretically very effective. And I think that's what these studies showed was that when dogs do respond, they will. But that we
Mhm.
should not think that every dog is going to be a responder and that it is. And we see that with other medications, right? We see that with our big four. Not every dog responds to
Yeah.
levetiracetam, right? They just don't. But then some respond better, significantly better than others. I was very
Don't
cautious how
talk
I
about
said that.
that with soap.
Was very cautious how I said that.
Sure thing.
That's a whole nother debate for us one night.
I'm not getting into this right now.
But
Yes, for some yeah, for the random dog might do well,
yep,
I've even had some dogs that I've, like, put on pheno that I'm like, "Oh, that didn't do diddly,"
I didn't do anything. Yep.
you know? That's not super common, but it happens, unfortunately, and that's true of everything. So just like you said, it's not replacing anything. If you wanna think of it as an adjunctive, we should also probably preface, like, we're not giving medical advice in these things.
No.
We're not giving medical advice, we're talking about literature. Um,
Yeah, I think it has place as an add-on, like you were saying, and
Um,
I think it I think it is another tool in our toolbox
yeah,
that can be used, but has to be used appropriately and safely.
yeah,
And I think we'll continue to get more information. I hope this group continues to do stuff. We hear tidbits and murmurings all the time coming out from this group about new things, and I thank them for doing the work and being able to get in there and leverage the fact that they were able to really look at this
yeah,
pretty early on compared to the rest of us, and really get some information, right? Because these are the things that people want to know, and now I feel like we have a lot more better information that we can talk at least about. Here's the risks that you could be
mhm.
looking at, and that it's not the wonderkin that a lot of people think it is or make it out to be, but it doesn't mean that we have to condemn it either.
No,
And I
no.
certainly won't.
Yeah, and I'm not, it's my main thing is I just get so nervous about the sourcing of it. Like
Yeah.
I don't know where you're getting it from. Like I don't know, and that makes me scared, and I feel so much like, at least for me, I don't know about you, but I get almost fatigued. Uh, Do you feel like you get an onslaught of people asking about nutraceuticals and even things like feeding raw diets and the potential risks with that? And then you kind of get to the point where you stop having you almost avoid those conversations. I mean, I will catch myself being like, God, I don't want to do this with you right now, and just being like, you can almost tell when somebody's gonna argue with you about it, or they're asking you the question because they're wanting your blessing for whatever they're doing, like feeding raw chicken feed or something like that. And I do think that maybe we need to be a little bit consistent and not say, well, it probably won't hurt, because like we don't always know that.
No, no, I think you brought up a great foundation of that, and how we use this, and it's not just the company that gets it right, it's the people farming the plant, and the whole process has to be considered and taken into
Yeah.
effect, and monitoring, right? Like, yeah, I know some people don't like pharma and things like that, but those laboratories have really high grade
Yeah.
levels, and so when you look at a product like Epilex and you're like, well, it's a pharmaceutical, which means it requires a prescription, but it's got a higher standard,
Yeah.
you know? Again, not to poop on Joe again, but you know, I can only imagine that, for them, they're okay with having higher percentage of THC in some of their products.
Yeah. Yeah.
You know, in the human world, that might be considered more of a benefit, but
Yeah.
certainly with our animals, it is. And it was really interesting to see that even without high percentage of THC, these animals still developed ataxia, still
Mhm.
had
Yeah.
some, and so, right, it's not just the THC component, or some of these animals were super sensitive to the very, very less than 0.3% THC that was in these
Yeah.
things,
Yeah.
by dry weight. So, at the end of the day, it solidifies a lot of what I have assumed we would be seeing with this, and I can feel better saying, "Hey, look, it is owner beware, but it is not necessarily a condemnation of it, but it's also not going to replace any of our day-to-day meds."
That's not a crazy endorsement for
Mhm.
first line therapy by any means. By
No.
any means.
No, and again, they definitely did not look at that aspect of this. That is definitely a whole 'nother can of worms in terms of, how should people use this monotherapy or things like that? And I think very much there is just no doubt out on that. And
Yeah.
without opening that can of worms or thinking people should go do that, that's not at all what these papers said.
No. Nope. Nope.
So, but
Good.
perfect.
Good
But
paper.
yeah, good papers, great papers, very informational, very much, especially during that time period where CBD was really seeing a big change in the different states. Answers the questions we needed, and even more questions that are still there, and I think we'll continue to see an increase in information in the
Yeah,
future.
I hope so. I hope so.
Yep.
Cool. Always a pleasure.
Always a pleasure, always an enjoyment. All right.